In equine assisted physiotherapy, the client is not riding, they are positioned with therapeutic intent. The equine's presence provides a calm and supportive foundation for targeted neuromuscular work. In this session, the therapist combines manual techniques with acupressure to influence spasticity and functional alignment. The client is carefully positioned to promote relaxation, so the therapist can work with precision. The warmth of the equine's body, the rhythm of its breathing, and the quiet shared space help to enhance the therapeutic effect. Specific points on the hand, wrist, and forearm are addressed to reduce muscle tone and encourage more functional movement. This is not simply about placing the client on the equine, it's about clinical intervention in a living, responsive environment. Every touch, every technique, every adjustment is grounded in neurophysiology and therapeutic skill. This is equine assisted physiotherapy, where equine presence meets specialist care. Scan the QR code to learn more in the Equine Assisted Therapy Clinical Specialist course.